So right now, we have the first session. It's an introduction to family medicine. Family medicine is a whole broad spectrum branch of medicine, okay? It's not a defined specialty. It's not concerned about a special organ or a special system or a special disease, okay? It's a broad spectrum specialty, and we are going through the session right now to be more defined of the family medicine spectrum, okay? So first, the definition of family medicine. Family medicine, as its name, okay, it's about family. It's about the whole family, the father, mother, children, and grandparents, grandfather and grandmother. So we have a bit of everything, every specialty we have in our specialty. We care about the common problems, we care about the common diseases, we care about the common social events, okay? We are a biopsychosocial aspect of medicine. So generally, we are the core primary healthcare specialty. Family medicine is a medical specialty devoted to comprehensive healthcare for people of all ages. We do not have a specific age or a specific race or a specific system, as I mentioned before. The key principles of family medicine. We are the first contact, okay? We are the primary healthcare physicians. So anyone who has illness or sickness or not feeling well, they go primary to the primary healthcare system or the primary healthcare unit next to his home or next to his address, the nearest to him. We are the first to interface with the person. And needed to mention now that we are not actually treating illnesses only, okay? We treat the patients, we treat the persons, and we treat the lifestyle. We are primary healthcare, which means that we need to focus on prevention and screening of the diseases before it occurs, okay? Meaning that vaccinations is our primary, very, very best of our work. Health education is one of the most important aspects of our specialty. Can you think of other important factors in family medicine? Dr. Babendra?
No, as of now, it's all.
Okay. Do you know a primary healthcare unit near your house or near your area?
Yes, yes, like it's in my society only.
Nice. Do you know the services that they provide their clients?
Yeah, all the OPD basis like procedures and the facilities are good. Like
Very
first,
basic.
yes, it's very basic. Like
Yes,
most of
very
like,
basic,
they're
very
just
common,
treating.
and very broad. Yes.
Yes.
Okay. So what we know about family medicine, it concerns the family, it concerns the members of the family, and we look in a wide base. It's not a vertical aspect, it's a horizontal aspect of medicine. We have 5 main principles in family medicine. First of all is comprehensiveness, which means that we need to provide full understanding and full awareness about the base and the background of the person we provide service to, okay? We do not just ask what's wrong with you. So he says or she says, my eye hurts or my ear hurts. So we just focus on the local examination of this organ or this system, and then provide investigations and then provide treatment for this specific, okay, organ or system. Then goodbye, see you in the other visit. No, your eye hurts, your ear hurts. So what causes this pain? What causes other problems that he might have? Okay. He sits to the computer very long, so his eye hurts. Or he stands in the sunlight very long. He's a hard worker or a hard labor, so he stays in streets very long. Or he has a bad socioeconomic states, which means he works for very long hours, so much work, so he's exhausted, and his exhaustion presents as eye pain. He's not really sick with his eye. It's just a matter of a headache or a stressful event in his life. There are many aspects we can look at during treatment and management of the patients we serve. An ophthalmologist will not look at the patient the same way. When the patient comes in and he says, my eye hurts, the first thing he will do as an ophthalmologist, he will check his eyes, he will check his vision, he will ask for some investigations, and as a result of all these lines, he will come up with eye drops or ointment or a systemic drug or anything he might see will cure his illness, and then bye-bye his patient, okay? Family physician is not working this way. Family physician will be comprehensive of the patient. He will seek the hidden agenda. The hidden agenda is much more than the visible pain or the visible disease or the visible sickness that's presented by the patient. And there are always hidden agendas with the patients. Human beings are very complicated organisms, okay? They have social backgrounds, they have psychological backgrounds, they have traumas, they have problems, financial problems or economic problems or family problems, okay? So the interpretation of all these circuits and where they intersect with each other to form the human being we're treating, that's the very meaning of family physician, okay? So first is the comprehensiveness. It's a very core principle for the family medicine. Second, the continuity of care. Family physician has the family file, okay? The family file, which contains a file for every member of the family with their diseases, with their problems, with their previous history or past history of any surgery or any major event. They have many papers inside. With each paper supplies various information and very important information about the member of the family. So as a physician, as a family physician, I do not just pick up the current event or the current paper and treat it as well, then goodbye, and the next visit, I just check for the new event and treat it and then goodbye. No, I take the file, I look at the file for the previous events. Are they related to the current event? Are they related to the current disease? Maybe he has or she has a past history of something that's directly related to the current pain or the current sickness or the current disease, okay? I do not, as a family physician, never, ever ignore the past events. I do not ignore the follow-up visits. I do not start all over again each visit. I continue my work with the family and the patient. Okay? I always continue my work. I always build a base and then start from each level to the second level. Okay? We are continuous. We are forwarders. We're not just specific to the current disease, the current illness, the current complaint, and then treat it and start over for the next visit, okay? That's continuity of care. We ask about the past. We ask about how did the events go? How did the illness was? The follow-up visits are very important to us because it shows us how our treatment worked. It shows us how our management worked. And management is not just treatment. Management is a multifactorial event we add to the patient's life. Okay? We have lifestyle modifications. We have health education. We have multifactorial stuff. A vaccine, a screening test. We have also medicine. Of course, we have medicines, but we have medicinal lines, various lines we can try. Okay, so continuity of care is crucial to the family medicine. Coordination of care, that's the third principle of family medicine. Coordination of care means that we are streamed up with various lines to be comprehended as a single map of treatment, okay? If someone asks me or a patient comes to me with a lung disease, he has cough, for example, or he has hoarseness of voice or anything related to the respiratory system, and he's a smoker, okay? The respiratory specialist will tell him to stop smoking or cease smoking, and smoking is bad for your health, sir, and then come up with some medicines for his cough, then goodbye for the next visit. But as a family physician, what will I do for this patient? He has cough and he's a smoker. I will tell him to cease smoking. Yes, okay, that's very good. But I will also tell him how to cease smoking. I will not just put the information at his face and tell him to go figure it out by himself. No, I will come up with him to a mandatory and acceptable management plan for smoking cessation, okay? That's acceptable by me and acceptable by the client, the patient himself, because I need him to be compatible with my plan and I need him to be compliant, okay? So the coordination of care is not just the adverse effects of the drugs related to his health, related to his work. I do not need him to take an antihistaminic, for example, in the light day of hours because he works. So at the daylight, so I don't need him to be sleepy, for example. So I will tell him to take the antihistaminic before sleep or at night. These are common for any specialist to know. No, I need to get the perfect plan and the perfect coordination for this specific patient. Someone will be easily smoking ceased within 2 weeks. Other will need months just to cease smoking or decrease the number of cigarettes he smokes per day. It's changeable. It's tailored to every patient. There is no fixed terms or fixed plan for everyone, okay?